Good morning, everybody. This is Heather Thomas with the Joint Information Center for Snohomish County's response to COVID-19. I'm going to take just a moment to click buttons to make sure that all of you that have joined us have permission to record. As a reminder, you do have permission to record this briefing, and the Health District is also recording, and we'll share this on our YouTube channel later this afternoon. So give me just a moment. Okay, I think I've given everybody permission to record, but if for some reason I missed somebody or you have issues, please go ahead and send a message through the chat feature to the Joint Information Center and we will get that fixed. Executive Summers was unable to be here this morning, but we are joined by Snohomish Health District Health Officer, Dr. Chris Spitters, and Chief Medical Director for Providence Regional Medical Center, Dr. Jay Cook. Each of our speakers will share an update, and after they've both shared their remarks, we will take questions using the chat feature. Please make sure to submit your questions to everyone so that all of our speakers can see. Thank you for joining us, and with that, I will hand it over to Dr. Spitters.
Well, thank you, Heather, and good morning, everyone. Thank you for joining us. First, just some logistics. Some of you may have noticed delays in our published case rates and weekly charts recently. This is due to the large number of cases being reported in recent weeks. That increases the amount of time staff need to process those reports and generate from them data and information that we can share with you and the community. As long as we continue to have such a high volume of cases, it may take us a few days longer each week than you've been accustomed to recently to get the most recent numbers out onto the website. So thank you for your patience in that. Case counts for the week ending August 28, last Saturday, show 2,042 new cases reported through last week. Together with the 1,700 cases from the prior week, that corresponds to a rolling 2-week case rate of approximately 446 cases per 100,000 residents for the period August 15 to 28. That's the second highest 2-week rolling case rate we've ever had, the highest one being back around the new year during the third wave of COVID. Here's another indicator of the high level of COVID activity in the community. Approximately 15,000 tests were done last week, with about 12 to 15% being positive. That's the highest positivity rate we've seen since April 2020, almost 18 months ago. One large healthcare system alone did over half those tests, more than they've ever done in a single week. Approximately 100 Snohomish County residents were hospitalized due to COVID last week. At this time last week, 85 people were in Snohomish County hospitals with COVID-19. As of this morning, that figure has risen to 96, with 9 of those requiring mechanical ventilation to breathe. This COVID hospital census has not been seen since the pre-vaccine era in December, January of this past New Year and March 2020. Without the benefits of vaccination afforded to the community by the roughly 500,000 Snohomish County residents who have lent their arm to the effort, our currently stressed healthcare system would be completely overwhelmed. So thanks to all of you who have gotten vaccinated. Our guest today, Dr. Jay Cook from Providence Regional Medical Center, will be sharing more on how things look from the hospital setting in just a few moments. Regarding the concern we announced last Friday about a possible exposure and transmission at a recent 3-on-3 basketball tournament in Arlington, we have identified at least 6 cases associated with the event, and further investigation is pending. All participants and attendees who were present at the event should still consider seeking testing. And if you are contacted by public health, please return calls the same day, if not immediately. Remember that cooperating with public health in disease investigations is both good for your fellow neighbors and is required by Washington state law. My last update is around testing locations and schedules for the coming weeks. As a reminder, the Everett location will be closed this Friday, September 2, as the Aqua Sox have a home playoff game that day. It will also be closed on Monday for Labor Day. So that site will, its last day of operation this week will be Thursday, and then it will reopen Tuesday, September 7th. We've also had a location operating in the south end of the county at the Lynnwood Food Bank. This Saturday, September 4, will be the last day that that location will be operating. We are finalizing details for 2 more new testing locations, one in the south and one in the north end of the county, that will provide additional capacity and flexibility as we move forward. Please look for more information on that coming later this week. Testing is still a critical part of disease control, and we encourage people who have symptoms to first stay home and also get tested. And then those of you who have been exposed and are quarantined, please also seek testing, ideally 5 to 7 days after your last exposure. For more information on our schedules and locations, as well as other testing resources in the county, please visit our website, www.snohd.org/testing, or you can call our center at 425-339-5278. In closing, I want to again plead with the 200,000 eligible and yet still unvaccinated individuals in Snohomish County to go get your vaccination series started as soon as possible, if not today. The vast majority of the bad news you're hearing about COVID and the Delta strain is affecting unvaccinated people. At this point, many community pharmacies are accepting same-day or even walk-in appointments. If not today, then set a date soon by when you will do it. And while these vaccinations far exceed what we were expecting in terms of effectiveness, they are not and cannot be our only tool, especially at times like this. We need much more complete vaccination coverage, plus other prevention measures. Please respect the masking requirement in public indoor spaces. Wear one in outdoor spaces when 6 feet of distancing cannot be maintained. Make sure the mask is of good quality material and wear it over your nose and mouth with a good fit around the edges. Maximize ventilation in indoor spaces, and again, maintain distance from people whom you don't live with in public areas. Before I turn it over to Dr. Cook to share more about what our local hospitals are seeing, I'd just like to mention that his leadership in Snohomish County's response to COVID cannot be overstated. He has ensured a high quality of care for what I would guess to be about 2,000 or more COVID victims who have been hospitalized at Providence since the start of the pandemic. He also works tirelessly to maintain the morale and the health of the hospital staff and has convened the county's healthcare system leaders and coordinated our efforts continuously since the start of the pandemic. So Jay, thank you for all that, and thank you for joining us today.
Well, thank you, Dr. Spitters. And again, I want to emphasize how strong our partnership has been with the Health District, and acknowledge the great work that Dr. Spitters and his whole team have done to help and promote and keep our county safe from this pandemic. And I want to just spend a couple of minutes sharing with you what our recent experience is here at Prov Everett during what is now the 5th wave of a surge of COVID cases since this pandemic started in January of 2020. In the last month, in the month of August, we admitted over 300 patients with diagnosis of COVID-19, and it's easy to calculate. That's about 10 or 11 cases a day, day in, day out. And of those patients who are vaccinated with active COVID infection, about 3/4, about 3/4 were unvaccinated. Even more telling, during the same last month period, August, we admitted about 75 or 76 patients to our intensive care unit. They were sick enough to require intensive care, and 96% of those, 96% were unvaccinated. So I think that illustrates very clearly the point that Dr. Spitters was making about the vaccine being just incredibly important, not only in preventing infection, but probably more importantly, preventing severe infection that could require intensive care unit, mechanical ventilation, or even death. In the last month, we've seen about 12 patients who have died due to COVID-19, and I don't have the vaccination status of those, but I can probably get that. But again, everyone in intensive care, save a couple, were unvaccinated. In the last month, or really probably 2 months, since about the 4th of July, Prov Everett has been operating really very close to our state hospital capacity. Our census has been incredibly high, both with COVID patients, as I mentioned, and also with non-COVID patients. Some of that we all believe is due to sort of a catch-up of the care that was deferred during the earlier parts of the pandemic. We're definitely seeing higher acuity patients who are presenting oftentimes at later stages of their disease and require a higher level of care. We know that the census of hospitals around Snohomish County, and indeed around the whole Puget Sound area, are also at capacity. And we're working closely with our Washington Medical Coordinating Committee to help accept transfers from other facilities, both in Snohomish County, but also throughout the whole Puget Sound area, and in fact, throughout the whole state of Washington, to prevent any single hospital from being just completely overtaken with COVID patients and the resources that it takes to care for them, and frankly also other non-COVID patients who are acutely ill and need care. As a result of our capacity issues, we have had to cancel some non-urgent procedures, both in the operating room and in other procedural areas like heart catheterizations. Even though these procedures are considered to be elective, or what that really means is non-urgent, some of them have been in patients who have a diagnosis of cancer who need surgeries. We've canceled a number of heart procedures and other things that everyone would agree are medically compelling, but could safely be deferred, for a few days or sometimes a few weeks. And while that may not, ultimately matter to the medical outcome of the patient, the strain that it places on the patient and their family when they, they're mentally prepared and often physically prepared to undergo a procedure, and then not be able to have it because there just aren't any beds, or the staff is limited to safely care for them, is really tragic and harmful. So we're working hard to minimize that, but it has definitely happened, and happened this week at Prov Everett, and indeed around the entire Puget Sound area. As Dr. Spitters mentioned, the thing that's a little different with this fifth wave of infections and surge of COVID cases compared with the previous four is that most healthcare providers feel like this one could have been prevented, or at least could have been much decreased if more people were vaccinated and followed the very simple, basic public health guidance that we've been given for the past 19 months, masking, distancing, and avoiding large gatherings, particularly indoors. And the strain that caring for this fifth wave of patients now, which is in many ways more challenging than the others, is really palpable. We have had staff leave. We have, people are burned out. Those that are still working. We're working really hard to ease the way of all our caregivers, but it is challenging as they see more and more folks come in who have not chosen to protect themselves, their families, and frankly, the caregivers who treat them by being vaccinated. So I will pause there, and I'm happy to try to answer any questions you may have.
Great. Thank you both, Dr. Spitters and Dr. Cook. We've got a number of questions, so we'll start with the first one. Dr. Cook, is there a plan or a strategy that your hospital is doing to try and recruit more staff to work? I know hospital staffing shortages have been plaguing most hospitals in the state, and wondering if there is a plan to fix that.
Yes, that is top of the list. Many of you know that we did have a labor negotiation that went a long time with our nurses that was resolved a couple of months ago, and because of that resolution, we've been able to raise our salaries and attract more folks, because before, frankly, we weren't as competitive with the salaries as we should have been, but now that has been resolved. Yesterday we had a job fair that was publicized widely, and I think we were successful in recruiting 30 or so caregivers, which is a good start, but we need much more. To fill gaps in staffing, we, like every other hospital, often turn to agencies that provide traveling nurses that on a contract that travel around the country and sort of fill in gaps, and that's been very helpful. But as the pandemic has flared up in various parts of the country, I mean, we're competing with all 50 states and all hospitals in Washington state for caregivers. And so the pool is not unlimited, and it's very challenging to do that. And as I mentioned earlier, I think the key for us is to try to keep the caregivers that we have engaged and make their workplace one that avoids burnout and is a place where people are feel safe, secure, and included, and really want to come to work for the mission that we have, which is to care for everyone, particularly the poor and vulnerable. I think that really resonates with a lot of caregivers around the country, really.
Next question. With Snohomish Regional Fire and Rescue firing back against the vaccine mandate and only 58% of the 260 emergency responders vaccinated, how do you handle this with a looming deadline for mandatory vaccination? And are you doing anything proactive to get first responders vaccinated? Are you concerned about low vaccine rates in some fire departments? Dr. Spitters, do you want to address that first?
Well, the health district, we don't monitor emergency response agencies coverage. That is, the requirement is what it is, and it's their governing boards and administration who monitor and enforce that. It's concerning if we lose emergency response workers because they become ineligible to work on October 18 because they haven't been vaccinated. That's going to not only be difficult for them, but potentially harmful for the community and our capacity to respond to emergencies. We don't have any specific intervention there. I mean, I don't know that you can do much more than make it a requirement and have that enforced by their agencies. But I want to say, that let's not get distracted from the tremendous contribution that EMS has made, not only just to the COVID response in general, but specifically with vaccination. It was EMS personnel that vaccinated the vast majority of people in adult family homes in the county, and other types of pop-up small clinics that were coordinated between the county and the health district, and generally staffed by EMS. So many of the workers in that field are the vaccine's greatest proponents, and we just encourage those who are not yet vaccinated to, talk to your colleagues who have been vaccinated, consult trustworthy information sources, and try to think about the big picture on this as we move forward, and the importance of vaccination for both occupational health as well as for community disease control.
And Dr. Cook, I'll add a question in there. Do you have any recommendations for first responders or others impacted by the mandate that might be on the fence about getting their vaccine?
Yeah, this I know is an emotional issue for some. That I think the evidence that we have, not only from the FDA's recent approval of the Pfizer vaccine, but also practical real world experience in the US, I think the number is over 360 million doses have been given, and worldwide something like over 5 billion with a B doses have been given. And the vaccine is remarkably safe, and it's remarkably effective in preventing severe illness, hospitalization, and death. The only real medical contraindications that are acknowledged by the Centers for Disease Control and Prevention are severe allergy to a previous injection. So there may be other mitigating circumstances in individual cases, but for the great majority of people, there is not a medical reason to not get the vaccine. The vaccine has been endorsed strongly by every professional healthcare organization and specialty in America, including the obstetrician and maternal fetal medicine professional societies that see patients who are expecting or want to get pregnant or breastfeeding. And in all of those situations, it has been deemed that the very, very small risk, infinitesimally small, is far outweighed by the benefit of not getting COVID. And as we're learning, getting COVID, patients who are pregnant who get COVID can have a very devastating outcome for both the baby and the child. So I think that while some skepticism is healthy, I don't think anybody wants to take anything that is truly experimental. But I think not only the FDA's approval, but the real world experience has shown that the vast majority, great majority of healthcare providers and doctors and nurses feel that this is safe and beneficial.
Thank you. Another question, I think, for you, Dr. Cook. We heard yesterday that some hospitals in Pierce County have set up tents outside at hospitals as hospitals reach capacity. Are we seeing that, or field hospitals anywhere in Snohomish County?
Yeah, I saw the same picture, I think. And right now we don't have plans to set up any field hospitals. This actually brings up an important point that I think should be more widely known. During the pandemic, we've had a surge of patients coming into the hospital, but at the same time, we're seeing increasing challenges with getting patients who are now well and well enough to go home, not so much home, but to a skilled nursing facility or other care site, having a very increasing challenge getting those folks out of the hospital. And, at any given time at Prov Everett, we have 70 to 80 of these patients who really don't have a medical indication to stay in the hospital, a medical condition that needs to be hospitalized for, that we're having challenging placing in adult family homes, skilled nursing facilities, et cetera. And, that also makes it challenging to get new patients in, particularly as we're at our bed capacity. And, patients have to wait, fairly long times in the emergency department. And I know there have been news stories about this elsewhere, but we're sure seeing this at Prov Everett too. And I think that, we're working closely with DOH and DSHS and our partners in the long-term healthcare facilities to find ways to break barriers down to allow successful hospital discharge of these patients who really don't have a condition that requires hospitalization, so that we can better care for those who do need hospitalization.
Thank you. Dr. Spitters, I'll connect these next couple questions together. Do you have any hope that the latest case rate shows a plateau of the fifth wave? And can you share more about what you're seeing in deaths and what's happening in the long-term care facilities?
Sure. This, as I said during the opening remarks, the 2-week rolling case rate, we're 446, almost the highest ever. And, I hope that's the top, but I don't think it would be safe to bet on that, or that anybody should let their guard down. What we need is more people putting their guard up, because without that, without more vaccination and more uniform, compliance with prevention measures, that number is going to still keep going vertical. There's hundreds of thousands of susceptible people in the county, and this virus has shown the capacity to find and infect them. Around long-term care facilities and deaths, first, speaking to Dr. Cook's point earlier, one measure of disease severity is death. And obviously, and that's the ultimate outcome we're all trying to prevent. Deaths have increased a bit in this wave. So for instance, in the month of July versus the first 3 months of August, we had 12 deaths in July, and I think we're up to 21 deaths in August through the 21st. Deaths are reported a little bit slower. Takes a little while to sort through those. So it's up, but it's not at the levels it was, say, during the first and third waves. And I think that speaks loudly, again, to the two things. First, the efficacy, the effectiveness of the vaccine in preventing severe disease, the kind that lands you in the intensive care unit or kills you. And then second, the high quality of care that is being afforded to patients now in all along, but with better outcomes. Hospitalized cases fatality rate was around 20% for sort of the opening months of the pandemic, and now it's down around 10%, and that speaks again to the vaccine and quality of care. So we are seeing an increase in deaths in parallel with this wave, but it's not of the magnitude we saw during previous heavy waves. Long-term care facilities, things have taken a definite turn for the worst in the last 2 months as this wave has unfolded. Once the long-term care facilities kind of completed their vaccination effort in March or so, COVID activity virtually disappeared in those settings for several months. And now gradually we're seeing cases here and there accumulating over the past couple of months, where we went from essentially no facilities affected, in the month of May, to now at the current time, We've got 26 different long-term care facilities with 94 associated cases in the past 2 weeks. 2 of those are skilled nursing facilities, 10 of those are adult living facilities, 5 adult family homes, and then a smattering of other types of long-term care. And when that happens in a facility, then they often are either shut down to new admissions or reticent to take on new ones because of the staffing impacts and infection control concerns around that. And that speaks again to the problem that Dr. Cook and his colleagues are having in discharging patients to such facilities. So COVID is really getting our acute care system at both ends front loading with new cases and making it difficult to get COVID and other recovering non-COVID hospitalized folks out to long-term care.
This next question, I think, is for Dr. Cook. Realistically, are we going to reach a point where the hospital system can't handle any more COVID patients?
So the short answer is, I sure hope not. The longer answer is a few things. One, if everybody who is eligible got vaccinated and we more consistently practiced masking and distancing, I am very confident that we would see this surge fairly quickly dissipate. We always want to hope for the best and prepare for the worst. And so along with other hospitals throughout the state of Washington, Prov Everett is preparing procedures for so-called crisis standards of care. And that those are put in place when a crisis affecting a scarce resource that's needed to care for patients has been reached. And so one such scarce resource might be hospital beds. One scarce resource might be intensive care unit beds. One scarce resource might be ventilators, certain drugs. When you reach that limit and there's no way to increase that resource by either transferring a patient to another facility or somehow finding another bed somewhere, then in essence you have to figure out a way to manage the next patient who comes when you're facing, you have nothing left to give, but then there's a patient who needs something. And so this is something that is very complicated. It has a large ethical and moral dimension. It also has, it's something that has been very well worked out in disaster management scenarios. That most of the disasters that we face in the past, though, have been something like an acute event. There's, a mass casualty event, something like that, where there's a really intense event that's very limited in its time frame, and you have to take care of a lot of patients all at once, but then it's over. This is different because this is a large number of patients that it has the potential to just keep coming and coming and coming over a long period of time, as we've seen in New York City and in Northern Italy and other places around the world that have seen these surges that have lasted for weeks, that have really overwhelmed the capacity of the healthcare system. So the long answer to your question is we want to prevent that by encouraging and the governor mandating all healthcare workers and other school teachers and others to get vaccinated, and then encouraging everybody else to do that. And then we are developing contingency plans if that's not enough, that we hope to never have to use.
Dr. Spitters, with the booster shots on the horizon, is the county getting ready to bring back mass vac sites? And can you talk a little bit more Can either of you talk about the desire among leaders to shorten the booster window to 5 months?
Well, this is certainly a hot topic, and everyone's got an opinion. But in public health practice, we are dedicated to, honoring the regulatory authority of the Food and Drug Administration, who authorizes or approves drugs and vaccines, and then CDC's Advisory Committee on Immunization Practices, who reviews the data from the clinical trials as well as real world data, and then makes recommendations for the clinical use of those vaccines. And then federally funded vaccines, which includes all COVID vaccines, are then implemented with those recommendations in mind. ACIP met yesterday, and the main reason for their meeting was to essentially endorse FDA's approval of the use of the Pfizer vaccine in individuals 16 years of age and up for a 2-dose series of that mRNA vaccine, as well as the continued emergency use authorization for adolescents 12 to 15 years of age. But toward the tail end of the meeting, they did talk about, they revisited the framework for considering recommendation for a booster dose, and presented a little bit of data, but the fundamental framework has not changed, which is first, regulatory authorization of a product for that use by the FDA, and then CDC will look at the data on efficacy or effectiveness, real world effectiveness in various groups, and make recommendations for use. So one of the things I sensed them signaling yesterday is that although it's on the horizon, and I don't, swim in these waters, but just listening to the meeting and the committee's members, I'm not sure that, that September 20 timeline is in sync with ACIP's thinking. I can't speak for them, but the timelines don't necessarily seem synchronized, and they remain dedicated to establishing a scientific basis for the timing and the designated groups who would be, for whom an additional dose would be recommended. And so while that's on the horizon, the details of the timeline, both for how long since the last dose, as well as when that would be implemented, and the specific groups for whom that would be recommended, are still to be determined. Certainly, the tea leaves might say something along the lines of 6 to 8 months, and looking particularly at long-term care facility residents, healthcare providers, other older adults as the next layer to look at additional doses. But for right now, currently an additional dose has only been recommended for moderately to severely immunosuppressed individuals who have received a 2-dose mRNA vaccine series. And I think we all just have to ride along with FDA and ACIP and follow and honor the process, which has historically been very robust and reliable in providing us with safe and effective vaccines and appropriate recommendations for their use. Having said that, of course, we're planning for all contingencies, including the need to everything from focus to widespread boosters, and the nature, how that would be manifest, whether it's with mass sites or through existing venues, will largely depend on the number and timing, number of people affected, and the timing of that. So we're planning for it, but I would say everybody's got to keep an open mind and let's watch the experts, let them do their thing. They've done a great job so far. I'm reticent to have anyone take the ball out of their hands.
Thank you. We have a couple questions about the Evergreen State Fair. I know there's questions about whether to be canceled. Executive Summers wasn't able to join today, so we'd encourage folks to reach out to Parks, as it would be a decision between the county and Parks. But Dr. Spitters, have we seen any cases, and thoughts about the Washington Hospital Association's recommendation for people not to attend large gatherings?
We have not had any cases reported yet that report their primary or only exposure as the state fair. So we just have to stay tuned on that. And, certainly, public health is always going to endorse risk reduction. So the more folks stay away from gatherings, especially indoor gatherings or tightly packed outdoor gatherings where people can't be safely spaced out, of course we don't want people doing that. Look, listen to what we've been talking about the last half hour. The words disaster and emergency and, crisis standards of care. That's what we need to avoid. So that's my view on it.
Dr. Cook, anything to add?
No, I agree with Dr. Spitters that we're not out of this yet. And everyone is tired of this, right? There's no one that likes not going to indoor events or tightly packed outdoor events either. I mean, I like all those things. And at the same time, we have to recognize that is a big risk for transmission of this deadly virus that continues to, inflict death and destruction across the country and across the world.
A couple quick last-minute questions. Is there any discrepancy between vaccine brands and breakthrough cases that are being seen and hospitalizations?
Not that I'm aware of, but maybe Dr. Spitters knows something I don't.
No, that's right, Jay. There's, those of you, if you're interested, you can Google, WADOH breakthrough report or some, and you'll get a hit. Every week they put out a new report. This most recent report did show a breakdown of breakthrough cases by vaccine product, and there's no clear signal there of any difference between the products.
And last question, have we seen any cases of C12 South African variant in the county?
Not that I'm aware of.
Not that I know of.